Today's interesting topic is arteries of the lower limb. First of all, in the thigh we have the femoral artery. It is a continuation of external iliac artery. This artery enters the femoral triangle at the mid-inguinal point. It is a point midway between pubic symphysis and anterior superior iliac spine. The femoral artery then passes downwards and medially and leaves the femoral triangle through its apex and passes beneath the sartorius or the talus muscle to enter into a canal called as adductor canal. So here is the femoral artery. It is a continuation of external iliac artery at the mid-inguinal point. It will continue into the adductor canal. Then it terminates at the level of hiatus magnus of adductor magnus and continues as a different artery because the area is different. It's the popliteal artery. So here we can see in the cadaver the femoral artery is the main femoral artery. These are its branches. Okay. So the femoral artery gives many branches within the femoral triangle. They are superficial epigastric to supply the anterior abdominal wall, superficial circumflex iliac artery to supply the gluteal region, superficial external pudendal artery. Pudendal means genital area. So deep external pudendal artery. Both these supplies the genital areas. Muscular branches to supply the muscles of the front of thigh. The profunda femoris artery. It's a deep artery of the thigh. And it goes backward to supply the posterior compartment of thigh. Then comes the descending genicular artery. The last branch. So here are the branches from the femoral artery. You can see that in these three pictures there are so many branches here. You can see the circumflex, superficial circumflex iliac, superficial and deep external pudendal, and superficial epigastric supplying the anterior abdomen. Here is the profunda femoral artery with its 4 perforator. Actually the 4th perforator is a continuation of profunda femoral. The interesting point to note here is there are 2 circumflex arteries from the profunda femoral. Lateral circumflex femoral, medial circumflex femoral. This is possible because the profunda femoral artery is anterior to the femur. So we have lateral circumflex femoral and medial circumflex femoral. They will wind across the upper end of the femur. And they give 3 branches. Ascending branches which goes towards the hip joint, descending branches which goes towards the knee joint, and transverse branches which anastomose with each other, the medial and the lateral circumflex femoral artery. This is the lateral circumflex femoral artery, whereas this is the medial circumflex femoral artery. That's the saphenous nerve for completion. The femoral artery is noted here in this picture. First it passes through the femoral triangle, then it continues in this canal called adductor canal. Ultimately it passes through the hiatus magnus of adductor magnus to be located behind the knee joint as the popliteal artery. This femoral triangle it gives the following branches: superficial circumflex iliac, superficial epigastric, external pudendal, and the profunda femoral artery. Muscular branches to the muscles of the front of thigh. You can see the profunda femoral is giving 4 perforator. Actually the 4th perforator is a continuation of profunda femoral. So these perforators will perforate something, and that something is, some structure is adductor magnus. Coming to the deep artery of the thigh, or the profunda femoral artery is the main artery of the thigh. It has got following branches which are already described: medial and lateral circumflex femoral arteries which winds across the upper end of the humerus. Then the descending branch coming from there, and 4 perforator arteries. The 4th perforator is actual continuation of the profunda femoral artery, or the deep artery of the thigh. Now to the next artery, it's a popliteal artery. Popliteal artery is located in the popliteal fossa, and hence the name popliteal artery. It is a continuation of femoral artery. Approximately it's around 20 centimeters in length. It passes downwards and laterally, lying in close contact with the floor of the popliteal fossa. It extends obliquely from the 5th osteoaponeurotic opening. Instead of that, you can just call it as hiatus magnus of adductor magnus. It's a large opening. In the adductor magnus, there will be 5 openings. 4 openings are there for the perforator arteries. The fifth opening is really large, so we can call it as hiatus magnus of adductor magnus. So it continues down, the femoral artery continues down the adductor magnus and becomes the popliteal artery. It ends at the popliteal artery, okay? It ends at the lower border of the popliteus muscle, has two terminal branches. They are the anterior tibial and posterior tibial arteries respectively, because one passes in front of the tibia while the other passes behind the tibia. This is the popliteal artery. You can see this here. It ends at the lower border of popliteus. This is a muscle, triangular shaped muscle. Lower border of popliteus, it's ending over there. It gives the following branches. Popliteal artery mainly gives genicular arteries. Now what is genicular? Genu means bend. Over here we have the popliteal fossa, four boundaries, the superomedial, superolateral, inferomedial and inferolateral. Corresponding name branches are there. Superomedial, superolateral, inferomedial, inferolateral genicular arteries. You can also call it separately like this. Instead, the easier version is superomedial, superolateral, inferomedial, this is inferomedial and inferolateral genicular artery. One more artery is there which pierces the capsule of the knee joint to supply the intra-articular structures in the middle of this area, popliteal fossa. So we call it as middle genicular artery. This popliteal artery ultimately ends up in, at the lower border of popliteus, it ends up in two arteries. One goes at the upper edge of the interosseous membrane to run in front of tibia. We are seeing the knee joint from behind here, while the other is a major vessel, it's a big vessel, and it's a posterior tibial artery. So there are two tibial arteries, anterior tibial and posterior tibial, out of which the posterior tibial is a larger branch to supply the calf muscle. In addition, the posterior tibial artery will give one artery for this area, the lateral bone of the leg. That is called the fibular artery or the peroneal artery. Why does the posterior tibial artery give? Because that is a larger branch. So only the larger branch can supply one more compartment, and that compartment is lateral compartment of leg is supplied by peroneal artery or fibular artery. So to summarize, the anterior compartment of thigh is supplied by femoral artery, posterior compartment of thigh is supplied by profunda femoral artery. The medial compartment of thigh is supplied by obturator artery. Not important. Obturator artery is one of the branch of internal iliac artery. It comes and supplies the adductor compartment of thigh through a foramen called obturator foramen. Now in the leg we have three compartments. Anterior compartment of leg supplied by anterior tibial, posterior compartment of leg or the calf area supplied by posterior tibial, lateral compartment of the leg supplied by peroneal artery or the fibular artery. So the branches of this popliteal artery, in addition to genicular, superomedial, superolateral, inferomedial, inferolateral, middle genicular artery, in addition to that, it gives cutaneous branches to the skin of the back of the leg, muscular branches to the boundaries of the popliteal fossa, and articular branches for the joint. The joint is knee joint. So it may terminate in the following areas. It's a variation. It may terminate at the upper border, distal border, or even trifurcate into three branches: anterior, posterior, and peroneal arteries. So the possibilities. There is a genicular anastomosis. The anastomosis around the knee joint, mainly formed by superomedial, superolateral, inferomedial, inferolateral genicular vessels. The function of any anastomosis in a joint is whenever we do bending in the knee joint, when there is flexion in the knee joint, the major blood vessel of that area is compressed, that is the popliteal artery. But these anastomosis will act as an alternate channel through which the blood can circulate into the tibial, anterior and posterior tibial artery and peroneal artery, so that the blood flow continues in an uninterrupted fashion. Okay, that's the purpose of any anastomosis. If the major vessel is blocked, the main road is blocked, the side passages are used so that traffic doesn't build up. Similarly, anastomosis does the same function. When the major blood vessel is blocked due to functional reasons, then the tinier blood vessels will act as a bypass road to continue the blood circulation. So the anastomosis around the knee joint is made up of following branches. In addition to whatever I mentioned, the genicular vessels, there are following branches. This branch, descending genicular artery, it's a branch of femoral artery. So you can see this branch is taking a turn. It's descending genicular branch. This one, the branch of femoral artery. Descending genicular branch of lateral circumflex femoral also will come. The descending genicular branch of the femoral artery is a major branch coming from the medial aspect. Then anterior tibial recurrent, you can see that here from the anterior tibial artery will give one recurrent, that is U-turn like branch, anterior tibial recurrent, and 5 branches from the popliteal artery, which you already know: superomedial, superolateral, inferomedial, inferolateral, and middle genicular arteries. So all these will cause anastomosis around the knee joint. Around the patella you can see a network of arteries are formed. Genicular vessels are coming from the popliteal artery, which you can see here from behind. Popliteal, it's given superomedial, superolateral, inferomedial, inferolateral, and through the capsule middle genicular artery is also coming. All these forms a bypass channel between femoral artery, anterior tibial and posterior tibial arteries, so that when you bend your knee, the blood flow to your leg and foot is not compromised. Come to the anterior tibial artery. The anterior tibial artery is one of the terminal branch of popliteal artery. So this anterior tibial artery later travels in front of tibialis anterior and extensor hallucis longus vertically down up till midway between the two malleolus, where it terminates as continues as dorsalis pedis artery, meaning dorsalis means dorsum, pedis means foot, artery means the blood vessel. Dorsalis pedis artery. So it's a terminal branch of popliteal artery. It continues as dorsalis pedis artery midway between the two malleolus. Already we see tibial recurrent, muscular branches, then nutrient arteries are also given over the cutaneous branches. It is one of the terminal branch of popliteal artery. It supplies all the structures present in the anterior compartment of leg, that is muscular branches. It extends up to the midway between the two malleoli, the median and the lateral malleoli, and it continues as dorsalis pedis artery. It gives off tibial recurrent branch, medial malleolar, lateral malleolar branch. So that is about anterior tibial artery. It supplies mainly the anterior compartment of leg. Moving on to the posterior tibial artery, it is one of the larger terminal branch of popliteal artery. It begins at the lower border of popliteus muscle. It is a major artery which supplies the posterior compartment of the leg. It travels vertically downwards under cover of the tendinous arch of the origin of soleus, between the soleal line of the tibia and the posterior surface of the head of the fibula. There is one tendinous arch. It passes deep to that. Ultimately, it passes behind the ankle and just posterior to the medial malleolus. So underneath the flexor retinaculum, it splits up into two arteries entering the sole or the plantar surface of the feet. One of that is medial, other one is lateral. So we call it as medial plantar artery and lateral plantar artery, because there are two arteries in your sole or the plantar surface. So medial plantar and lateral plantar artery. Along the entire course, the posterior tibial artery is accompanied by a pair of veins that are called venae committents. This is the posterior tibial artery. You can see it's passing deep to the tendinous arch of soleus, vertically down, just behind your medial malleolus, near the flexor retinaculum, splitting into two branches, the medial and the lateral plantar artery. One of the branches from this posterior tibial artery, circumflex fibular artery, is one of the major branches which encircles the neck of the fibula, and anastomosis in the inferolateral genicular anastomosis along with tibial recurrence. Other major branch is for the lateral compartment of the leg. It's called peroneal artery. Minor branches include the nutrient artery for the bones of the leg, muscular branches for the posterior compartment of the leg, the muscles, calf muscles. Terminal branches include the medial and the lateral plantar artery for the sole of the feet. So this is a posterior tibial artery. Once again, it's one of the terminal branch, supplies all the structures in the posterior compartment of leg. One of its branch called peroneal artery also supplies lateral compartment of leg, that is peroneus longus and brevis. It runs just behind your medial malleolus. It terminates into medial and lateral plantar artery. It gives off peroneal artery, which I already told you, it's a major branch supplying the lateral compartment of leg. Also gives lateral malleolar branches for the lateral part of the malleolus and calcaneal branch to your heel. Come on to the dorsalis pedis artery. An artery on the dorsum of the foot is called dorsalis pedis artery. It is a continuation of anterior tibial artery. Midway between two malleolus, it continues as dorsalis pedis artery. It passes in front of the ankle joint, along the tibial side of the dorsum of the foot, that is the medial side. Then at the proximal part of the first intermetatarsal space, it takes a turn like this. So it's like an arc. So it's called the arcuate artery. So dorsalis pedis is a continuation of anterior tibial. It continues as arcuate artery in the dorsum of the foot. It gives a medial talar, lateral talar branch, muscular branch, articular branch. One of the major branches, this one, which runs on the dorsum of the first metatarsal, so we call it as first dorsal metatarsal artery, and it also gives a perforator, the first perforator, to complete the plantar arch. It's an arterial arch, so that is also one of the major branch. That is the first perforator and first dorsal metatarsal artery. So same thing in a more beautiful manner, the artist has written here. Dorsalis pedis, continuation of anterior tibial. Here I can see in the proximal part of the first intermetatarsal space, it is turning like this. Near the base, it's like an arc, so we call it as arcuate artery. And here it's giving first dorsal metatarsal and first perforator artery. It's continuation of anterior tibial midway between the two malleolus. Lateral tarsal, medial tarsal for the tarsal bones. Medial, lateral tarsal and medial tarsal. Arcuate artery. First dorsal metatarsal and first perforator artery. To summarize, dorsalis pedis gives lateral and medial tarsal branches, arcuate artery, first dorsal metatarsal and first perforator artery. The clinical importance of dorsalis pedis artery is one of the important arteries similar to radial artery of the upper limb for assessing the peripheral pulses. So the pulsation of this can be felt just lateral to the extensor hallucis longus, or you can tell midway in between extensor hallucis longus and extensor digitorum longus. Ask the patient to extend the great toe, that is toe points skywards. That time a tendon stands out, then palpate just lateral to it, press against the bone. So you will feel across the dorsum of the foot. Okay, so dorsalis pedis artery, you can feel the pulsation. Anastomosis around the ankle joint is formed by the following branches: the calcaneal branch of tibial artery, peroneal artery. You can see these are the calcaneal branches. Okay, then medial mallular, lateral mallular branches of the tibial artery and the peroneal artery. Okay, so mainly it is formed by the calcaneal branches of the tibial and peroneal. You can see that here, calcaneal branches of tibial and peroneal, and medial mallular, lateral mallular branches of anterior tibial, posterior tibial and peroneal artery. What are the last but not the least? Plantar arteries. These are the arteries present in the sole of the foot. It is a continuation of posterior tibial artery which splits up underneath the flexor retinaculum. On the medial aspect we call medial plantar, on the lateral aspect we call it as lateral plantar. So there are two arteries here, medial and lateral plantar artery. Medial plantar artery is a smaller branch, whereas lateral plantar artery forms an arch. It's called the plantar arch. This arch is giving, we can clearly see that it's giving plantar metatarsal arteries, 5 numbers. See, 1, 2, 3, 4, 5. 5 plantar metatarsal arteries. Similar branches are there in the dorsum of the foot. It's called dorsal metatarsal arteries. The plantar metatarsal arteries are connected to the dorsal metatarsal arteries by perforators, proximal and distal perforator arteries. Whereas the medial plantar artery supplies the great toe and the muscles around the ball of the great toe. The plantar arch is mainly formed by lateral plantar artery, and it's completed on the medial aspect by, I told you, the dorsalis pedis gives one perforator branch, the first perforator. So that one will complete the deep plantar branch, or the first perforator branch of the dorsalis pedis will complete the plantar arch on the medial aspect. So that is a plantar arch for you. In the gluteal region, we missed out a few vessels. That is a superior gluteal and inferior gluteal vessel, which will have descending branches and ascending branches above and below piriformis respectively. The superior and inferior gluteal arteries are there. In addition to this, one vessel is there, internal pudendal vessel, which winds around the ischial spine and enters into the pelvis and supplies the internal portion of the genital. In the gluteal region, superior gluteal artery runs above the piriformis, between the gluteus medius and maximus and medius towards the minimum. The inferior gluteal artery, on the other hand, is given off on the lower border of the piriformis. It descends down mainly to supply the muscles of the gluteal region. This is the superior and inferior gluteal artery. Anastomosis in the lower limb, one small topic. If you can concentrate for 5 minutes, anastomosis of the lower limb will be over. There are three major areas where anastomosis takes place. One at the level of hip region or the gluteal region, and the second one is at the level of knee joint area, third at the level of ankle joint, and also in the plantar area by the perforators, proximal and distal perforators. So why is this anastomosis actually required? Anastomosis between different arterial branches are actually required to ensure continuous blood circulation in case of occlusion of any major vessel whenever we bend a joint. It may be a knee joint, hip joint, or an ankle joint. When we bend, the major vessel is blocked for a temporary period of time, but still we want the blood circulation to continue. In the gluteal region, we have cruciate and trochanteric anastomosis. Gluteal region of the hip joint area, we have cruciate and trochanteric anastomosis. In the knee joint area, we have the geniculate anastomosis or the genicular anastomosis. And in the ankle joint, we have mallular anastomosis. In the sole of the foot, we have plantar anastomosis. So in the ankle joint, it's called mallular anastomosis, and in the sole, it's called plantar anastomosis. Let's move on one by one. Anastomosis in the gluteal region is mainly, or the hip joint area is mainly, cruciate anastomosis and trochanteric anastomosis. What is cruciate? Cruciate means plus or X-shape anastomosis. So this is an anastomosis which is found at the lower edge of the quadratus femoris, a quadrangular muscle. It is very simple, medially and laterally. It is formed by the transverse branches of medial circumflex femoral and lateral circumflex femoral. From above, it should be descending branch. From below, it should be ascending branch. From above, descending branch of, is it superior gluteal or inferior gluteal? See, slower down. It's inferior gluteal artery. From below, there will be 4 perforators, okay? Perforator arteries. Ascending branch of, obviously, first perforator artery, because that is the one which is at the highest level. So this is for summarization purpose. Cruciate anastomosis, medially, medial circumflex femoral, laterally, lateral circumflex femoral, superiorly, descending branch of inferior gluteal, inferiorly, ascending branch of first perforator. Same thing, line diagram. Next one is trochanteric anastomosis. This is mainly formed by again medial and lateral circumflex femoral artery, but in this scenario it's a ascending branch of these two and descending branch of superior gluteal because it's at a higher level. Also inferior gluteal also gives a minor contribution. So here these are the two circumflex femoral artery because it's taking place at the level of trochanteric fossa, the greater trochanteric area. So it's ascending branches of medial and lateral circumflex femoral. Medial is this one because head is directed medial. Ascending branch of medial circumflex, ascending branch of lateral circumflex femoral artery, and descending branches of superior gluteal and also inferior gluteal, descending branch. So 2 gluteal arteries and 2 circumflex femoral arteries. Circumflex femoral artery will be ascending branches, gluteal arteries will be descending branches. That is happening in the trochanteric fossa or the greater trochanteric area, therefore the name trochanteric anastomosis. Anastomosis around the knee joint is extremely simple. This is anastomosis of the knee joint. This is the medial side, this is the lateral side. See, fibula is there, that's why it is the lateral side. Supromedial genicular artery, suprolateral genicular artery, infromedial, infrolateral genicular artery, middle genicular artery. All these 5 branches are branches from popliteal artery. They anastomose with descending genicular branch of femoral, descending genicular branch of lateral circumflex femoral, tibial recurrent, and some authors tell even peroneal recurrent. So this is summary. 5 branches of popliteal I just noted. Supromedial, supralateral, infromedial, infrolateral, middle genicular. All these 5 branches are from popliteal artery that is present on the popliteal fossa, the posterior aspect of knee joint. Will anastomose with branches of femoral and profunda femoral, tibial, and some authors tell even peroneal. That is a fibular recurrent. Anastomosis on the ankle joint is mainly the calcaneal branches of tibial and peroneal with mallular branches. Medial mallular, lateral mallular from anterior tibial. Similar name, medial mallular from posterior tibial. Lateral mallular is from fibular or peroneal artery. These mallular branches of anterior, posterior, and peroneal arteries with calcaneal branches of posterior tibial and peroneal artery. The anastomosis around the ankle joint. Thank you for your patient listening. Hope this helps. If you are new to our channel, kindly consider subscribing to our channel and don't forget to press the bell icon. If you like the video, press the thumbs up icon. Thank you once again for watching and learning from Logic Medico.